prostate cancer. Ke sa itse gore prostate cancer go tewa eng. Nna leina la ka ke Motibi John Mooketsi. Ba ne ba tsana gore ba nthomele hospital ba go ncheka ko hospital ko dingake ene ke le ka tsamaya lo ka ya hospital well dingaka di ncheka yalo mare dingaka di ncheka lo ba mpolela le bone gore ne ona le prostate cancer and then ke re ne nna ga ke fui next selo se bua and ke le ka tsamaya yalo banna ba re ne o tseka kgwedi ya gore ka letsatsi le gore ke dira yala ka dingaka di bua le from there ke ha ba naya treatment gore jaanong ke tsamaye treatment ke tsamaile ntse ke tsamaya treatment hela.
Previously, there were waiting periods of more than 6 months for radiation therapy for patients because they had to travel to Bloemfontein, which is 1.5 hours away from Kimberley. And Bloemfontein has a large drainage area of its own, so our patients often were pushed to the end of the queue. They had no bed space. They would be sent back and forth, sometimes traveling up and down 3 or 4 or 5 times waiting for an appointment date for their radiation.
But they can just not give it a corner for the key blow and so fella mama mo le bana kya blow mo on na biki heavy fun that's why ke itumedetse thata machine o bana bantse mo go yone ene le dingaka tse di imperekileng. And it was very good for me.
So this process started way back in 2015. Shortly after I joined the company, we had submitted an unsolicited bid to Northern Cape Department of Health in 2015 to try and collaborate with them to treat radiation patients here in the Northern Cape. At that time, there was no radiation facility at all, and all the patients had to go through to Bloemfontein for treatment. So the government does have buses that go out to far off-reach areas that bring the patients through, and then they remain in Kimberley at the State Hospital for the duration of their treatment. Accommodation was always an issue, but the RMSH Hospital, they have secured a 20-bed ward which they've been able to convert to house patients during their radiation treatment. This ward has space for 20 patients, 10 male, 10 female. Not all of them are sick enough to be inpatients, but because it offers accommodation, it helps the patient complete their treatment. And the state does have transport services. So there is the outlying transport bus. There is also transport service between the hospital and our facility. And then there is a bus in the local area that the state goes and fetches patients from their homes.
Our patient, he was diagnosed last year, mid-last year, around October, July. And he's the person that he was doing his annual checks. So likely he was diagnosed then, and during the diagnosis stage, he was at a very early stage. So we were treating with the intention of curation. So it's a radical intent treatment. So he get all his plus minus 7 weeks treatment when he was coming from home on daily basis.
Treatment bula maikutlo gore ke tsamaya ka ba bua mateni ao ke sa ikutlwe dipeni ke sa ikutlweng mare vela ke ile ka itsamaya letsapa lone nke ipheletsa mare after that ha ba sna go ntaba re ke siame ke ikutlwile very well wa itse ke ikutlwa fat gore ke boya ke ikutlwa sentle go dira hela jaaka ntse ke bereka nna ke itumeletse thata machine e bana ban treata ka yone intusitse very nice and the doctor, the nurse, service are very good for me.
It's a major success. It's actually more than a success. It's a life-saving partnership. Personally, as a clinician, I'm proud of the fact that we, as a tertiary hospital, we are able to give access to radiotherapy services. Since this partnership, I think we've saved quite a lot of lives. And what made it also possible is partnering on staffing that unit with ICON, where they would give us a contracted nurse to be able to assist us in the unit.
For me, this collaboration between ICON and the Department of Health, specifically this hospital, I think it's one of the best things that could happen for the sake of our oncology patients.
This is really a collaboration model. So the state oncologist sees the patients and sends them to the state CT scanner for a planning CT scan. Then our radiotherapists import that scan into the private planning system, and the state oncologists, they then plan the patient via a network, and then our radiotherapists help approve it. And when that's done, we then contact the state to bring the patient in. It is truly a complete collaboration, and it shows that it can work. And I do believe that this can be replicated further into other provinces.
I would really encourage every province to get involved with this, even if they have their own radiation therapy units. Just the collaboration, the expertise that ICON brings on board, they can even assist with nursing, whatever need there is, that's not necessarily immediately available in public hospitals. And the joy that they bring, I want to say, is the one thing that everybody can share.
Somebody once said, find a job that you love and you'll never work a day in your life. I can't remember the exact words, but that is truly something that this contract has offered me. I feel that every day we are doing something good. This has a higher purpose than just a job for me. We all know that South Africa is one of the most unequal societies in South Africa. The Gini coefficient of 63, it's crazy. And to be able to offer first-class treatment to state patients where everybody gets the same treatment is an absolute winner for me. It hits me in the heart and it makes my role at ICON very special. It makes it more than just a job. For me, it is a passion.
Ke itumela thata ka treatment ya ICON. In thusitse thata. Ke godile a ke tlhole ke ikutlwa wa-twate ke siame. Ke leboga le Jehova Modimo ya ntiretseng dikgakgamatso.